About heredity, environment, and psychoactive drugs, we're going to explain why some people are more addictive than others, or more susceptible to addiction than others. I believe. There we go. Psychoactive drugs are substances that directly affect the central nervous system. The method that a drug gets into the brain are called pharmacokinetics, literally drug movement. It is absorbed, it's distributed, it's metabolized, and it's eliminated. And that has to do with pharmacokinetics. So how do all these take place? Pharmacokinetics have to do with the route of administration. And as you can see, this lady is burning opium and sucking it through a straw. And that's called chasing the dragon. The speed of transit into to the brain. How fast does it get into the brain? And we're going to talk about that in just a second. The affinity for nerve cells and neurotransmitters. Which ones does it affect? When a psychoactive drug can get to its target in the central nervous system rapidly, the more addictive it tends to be. And of course, this is crystal meth. Tobacco is the most addictive substance that is known to man. It has an immediate rush, dopamine rush that pops into your brain. Hence, the people are addicted to it. Inhaling, when a person smokes a psychoactive substance or draws it in as a vapor, as with nitrous oxide, or inhaling an active chemical solvent, colloquially referred to as huffing, the drug enters the individual's lungs. The drug is rapidly absorbed through the capillary lining of the alveoli of the bronchi. And this is what huffing looks like. Ain't they cool? The psychoactive substance travels through the body with the blood and is pumped to the brain and the tissues of the body, and may reach the brain in as short as 7 to 10 seconds. That's when you snort it. Inhaling is the most rapid method of getting a psychoactive substance into the system. Individuals are able to control levels and reactions of the psychoactive substance, known as titration, by regulating the frequency of use and the depth of inhalation. This is why most tobacco smokers spend more time holding their cigarettes than actually puffing them. They're maintaining the titration. They're controlling the titration. And of course, this guy doesn't count. My goodness, how many cigarettes does he have there? Since smoking is an inefficient means of administering the psychoactive properties of marijuana, THC, 60% of the substance is lost. Pharmaceutical companies are working on aerosol and nasal sprays to deliver the THC, and these are known as Marinol and Dronabinol. This method would also eliminate the tars and other toxic substances that make marijuana carcinogenic. I just read an article, a research article. They were talking about which is worse, tobacco smoke or marijuana smoke, and they said they're equally bad because they have the same tars and nicotine in it. People have been arguing for years that since marijuana is a natural herb, that it's better for you. It doesn't do as much damage to your lungs as tobacco does. But the reality is they're both natural. They're both herbs, and both of them have tars and nicotine, or tars in them, and that's what does the damage to your lungs. So, according to this study, the marijuana was just as bad as the tobacco. Injecting is where the individual introduces a psychoactive substance into the body by using a hypodermic needle and a syringe. There are 3 methods of injecting appropriate psychoactive substances into the body. Intravenous, into the vein, colloquially known as slamming. This is where the psychoactive substance is injected directly into the bloodstream. This method delivers a psychoactive substance through the bloodstream into the brain in about 15 to 30 seconds. This method is the most likely to create a head rush, an intense feeling of excitation and mental electricity. Intramuscular, into the muscle, colloquially referred to as muscling. The psychoactive substance is injected directly into the muscle. This method of introducing psychoactive substances through the bloodstream and into the brain in about 3 to 5 minutes. This method will not create a head rush, but a slower buildup of euphoria. Subcutaneous, under the skin, colloquially referred to as skin popping. The psychoactive substance is injected directly under the skin. This method of introducing psychoactive substances through the bloodstream and into the brain in about 3 to 5 minutes. This method will not create a head rush, but a slower buildup of euphoria. And it creates, this stuff is toxic, and that's one of the reasons why it causes these circular structures or scars on the arms. I had a friend when I was up north who was a skin popper, or had been in the past anyway, and he had these really cool scars all over his arms. Of course, you don't have to only shoot your arms; you can use your legs. This guy's used his legs. That's an arm. That's a mess. Ugh. Injection is the most dangerous method of introducing drugs into the body because once they are entered, there is no turning back. Injecting also introduces the user to a whole host of contaminating infections such as hepatitis B and C, syphilis, and HIV. The individual is also more prone to abscesses and embolisms. Embolisms are another name for blood clots. This man is not dead. He's just acting like he is. He's stuck that needle in backwards. This guy did it right. Wait a minute. He's doing it right. Because that's the way the blood's flowing. And if that's what you need to do. If you try to go against the blood flow, it's going to run right back up into your syringe. Yeah, so he didn't do it right. Mucous membrane absorption. Select psychoactive substances that come in a powdered form can be inhaled through the nose and absorbed in the capillaries found in the mucous membrane. This is how cocaine is snorted, heroin is snorted, methamphetamines can be snorted, and so you can grind up OxyContin and snort it. This method is much more rapid than oral ingestion. It bypasses most of the body's defenses, the digestive juices, the enzymes in the liver. Besides snorting through the nose, there are 2 other methods used. Buccally, between the gums and the cheek, like you do snuff, and sublingually, under the tongue. And of course, if you have, well, of course you haven't. That's how they administer nitroglycerin to people having heart attacks. They do it sublingually. If they put it in the mouth, the enzymes in the mouth will destroy the nitroglycerin, and it doesn't work. So it's got to be under the tongue. Absorbing drugs through the mucous membrane in the rectum and the vagina are also possible. This is usually administered as a suppository, but can also be used for recreational drugs such as ketamine and cocaine. I have heard of, I guess we saw this a little bit more than we needed to. Women would soak tampons in alcohol and put them in their vaginas, and they would get drunk faster. Yeah. We saw too many things stuck up people's rectums. Sometimes what will happen is if anything you shove up there, the anal sphincter will close up, and sometimes it actually goes the wrong direction. It goes up instead of coming back out. And of course, sometimes you can get it out, and sometimes you have to go in and surgically remove it. This looks like it was way too big to come out. So they probably had to surgically remove it. Strange things you see. People do. Oral ingestion, when a drug is swallowed, it goes through the esophagus into the stomach. It passes into the small intestines, where it is absorbed by the capillaries in the mucosal lining of the intestines. This method requires between 20 and 30 minutes before the drug begins affecting the brain. And of course, if you take aspirin or ibuprofen or acetaminophen and your headache goes away immediately, it was probably a tension headache because the relief shouldn't have been there for another 20 to 30 minutes. But if it goes away right away, then obviously it wasn't a migraine. If the psychoactive substance is a beer or other alcoholic beverages, about 10 to 20% of the substance will be metabolized by the stomach. Males tend to metabolize alcohol faster than women and thus get drunk slower than a woman who consumes the same amount of liquor. One of the things we're going to learn is that females have less alcohol dehydrogenase to break down the alcohol in the stomach, and for this reason women get drunk faster than men. Most psychoactive substances are fat soluble and so move readily across the membranes. Alcohol is both fat and water soluble. That's one of the reasons why people get drunk so rapidly. And when you gotta puke, you'll puke just about anywhere, including sticking your head in a urinal, I guess. Transdermal absorption. Drugs are now being impregnated on adhesive patches so that the medication can be slowly absorbed through the skin. Some of these patches provide medication for up to 7 days, though it may take as long as 2 days before a therapeutic level of the drug makes it into the system. And they have transdermal patches for a lot of different things. Nitroglycerin is one. Another is fentanyl. They have a transdermal patch for fentanyl. Because of various factors, psychoactive substances in the blood do not remain in the system for the same length of time. This is known as bioavailability. There are various factors that restrict the availability of the psychoactive substance to the target tissue after administration. Once a psychoactive substance enters the bloodstream, it can be transported inside the blood cells and the plasma by attaching itself to protein molecules. It all depends on the chemicals that we're dealing with as to how they get into the system. Some do it by attaching to the blood cells, some that travel in the plasma, and others have to attach themselves to protein molecules. The psychoactive substance will visit every organ in the body where it will either cause an effect, be ignored, be stored, usually in the fat cells, be biotransformed, broken down into chemical variations that may or may not cause psychoactive effects. An example for being stored would be marijuana, or the THC in marijuana. What happens is that it is fat soluble and therefore it gets into the body fat. And that's one of the reasons why it doesn't clear the body very readily, very fast. And that's why you can test positive for marijuana 10, 15, 18 days after you smoke the marijuana. So for people that smoke marijuana every day, a lot of times what happens is that individual will keep a level in their body all the time. And so they will kind of stay stoned all the time. I guess that makes them happy. Well, the chemical structure of the drug is a factor in distribution, so is the size of the individual. A lighter person with less blood volume will have less blood to dilute the chemical. The blood volume of an adult is 6 to 8 quarts of blood. Children have about 3 to 4 quarts of blood, so they have less. The same amount of drugs in an adult would have half the effect that it would have on a child. Organs with extensive vascularization will be affected by a drug to a greater degree. This is one of the reasons why cocaine can cause fatal heart reactions. Too much of the drug affects the highly vascularized heart, causing cardiac arrest. Humans would have died from bacteria, viruses, and toxins at the beginning of our evolution if it weren't for our ability to keep most of these substances out of our central nervous system. The walls of the capillaries that feed the nervous system consist of tightly sealed epithelial cells that only allow certain substances to penetrate. And this is known as the blood-brain barrier. And you can thank your lucky stars that you have this blood-brain barrier, because if you didn't, you probably would have died in infancy. Luckily for those who need a chemical assistance on their lucidity, psychotropic medications do cross the blood-brain barrier and change serotonin, GABA, etc. To reduce the symptoms of depression, anxiety, or whatever. The chemicals that people use as psychoactive substances also will cross the blood-brain barrier. Otherwise, they wouldn't be taken, since there wouldn't be a brain reaction to them. And of course, once again, I have a picture of Amy Winehouse, who died of an alcohol overdose, but she was a notorious marijuana smoker. The reason psychoactive substances cross the blood-brain barrier is because the brain is very fatty, and most psychoactive substances are fat-soluble or lipophilic. Lipophilic means fat-soluble. Nicotine is lipophilic, so is alcohol, and certainly marijuana. Okay, so how long does this stuff stay in your system? Amphetamines, 2 to 4 days. Barbiturates, 4 to 7 days. Benzodiazepines, 3 to 7 days. Cocaine, 2 to 4 days. Ecstasy, 1 to 3 days. Methadone, 3 to 5 days. Methamphetamines, 3 to 5 days. Opiates, 2 to 4 days. Fast-acting opiates and slow-acting opiates, 2 to 4 days. Phenylcyclidine or PCP, 7 to 14 days. THC, they hold the record, 15 to 30 days in your system. Tricyclic antidepressants, 7 to 10 days. Propoxyphene, 1 to 2 days. Oxycodone, 2 to 4 days. Amphetamines, 2 to 4 days. Cocaine, 2 to 4 days, and methamphetamine, 500 milligrams, 3 to 5 days. Drugs that are completely fat-soluble will cross the blood-brain barrier very rapidly. Drugs that are only partially fat-soluble will cross the barrier much slower. This is the case with morphine, which crosses the barrier much slower than heroin. This form of crossing the barrier is known as passive transport. Active transportation takes place when a water-soluble or hydrophilic, hydro meaning water, philic meaning love, hydrophilic chemical needs to cross the blood-brain barrier. A water-soluble chemical must first attach itself to a chemical structure that will readily cross the barrier. In the case of cocaine, cocaine hydrochloride attaches itself to protein molecules. Most water-soluble substances, such as antibiotics, will not cross the blood-brain barrier. The blood-brain barrier does not completely develop until the individual is 1 or 2 years old. So babies don't have a very strong blood-brain barrier. Toxic chemicals that will not injure adults cross an infant's barrier and cause brain damage. The placental barrier protects the developing fetus from water-soluble chemicals. But since most psychoactive substances are fat-soluble, the fetus uses what the mother uses. So every time she takes a slug of booze, the baby takes a slug of booze. Every time she shoots up with heroin, the baby shoots up with heroin. Every time she smokes methamphetamines, the baby smokes methamphetamines. The body is always trying to rid itself of foreign substances, whether they are harmful or helpful. The body doesn't want that stuff. It considers it toxic, these substances. All these psychoactive substances that we're talking about, the body considers them all toxic. And therefore, the body is always trying to neutralize itself. At once, it is seeking homeostasis. It's seeking a balance constantly. So if you drink alcohol, or if you shoot up with heroin, The body's trying to get rid of that stuff, and it will shut down, it will slow it down, it will shut down parts of your body that are affected by the drugs, and it will reduce the amount that your body reacts to it. And this is what tolerance. This is why we refer to things as being tolerant, being tolerated. It is making it less sensitive to that substance, and it tries to get rid of this stuff as quickly as possible. Now, when you are evil and drink too much alcohol, your liver's trying to get rid of all that stuff. It's going, "What are you doing to me?" And of course, it kills liver cells. But your liver's constantly working. So if you snorted, if you were huffing chemicals, snorting cocaine, your kidneys and your liver trying to get rid of it. The body tries to get rid of these horrible substances in two different ways. One is metabolism, processing using the inactivity and inactivating the substances, and most of this takes place in the liver. You excrete it out of your body through your kidneys. This is where you expel the foreign substances and metabolites from the body, and this, of course, takes place in the kidneys. So if you do too many drugs, you'll do damage to your kidneys, and you certainly do damage to your liver, because that's its job, is getting rid of toxins. When the liver metabolizes alcohol, it breaks it down into water and carbon dioxide and excretes it from the body through the urinary tract, the sweat, and as vapor from the lungs. And if you've ever been around somebody that is drunk, you can smell it on their breath. You can smell it in their sweat. The reality is, if you drew a vial of blood and opened it up, you could smell it in their blood. As weird as that sounds, we used to draw blood alcohols all the time. And I worked with a lady who was able to sniff a tube of blood, and she was able to open it up, and she could tell how much alcohol the person had in their body, and that she would guess, and later she would run the test. And usually she was really pretty close. This is Lindsay Lohan, of course, when she was drinking. She's married now, and she has a child, I believe. This just recently happened. The liver breaks Valium into four metabolites and that are actually active in themselves and affect the brain. A measurement of the metabolism of or elimination of a chemical is its half-life. It takes 6 half-lives to break a chemical down so that it isn't detectable. Cocaine's half-life is 30 to 60 minutes. It's detectable for 3 to 6 hours. Methadone, its half-life is 15 to 60 hours. It's detectable for up to 15 days. THC, its half-life is 20 to 30 hours. It's detectable for 5 to 7.5 days. Prozac, its half-life is 1 to 6 days. It's detectable for 6 to 36 days. Clearing the system is based on many factors, so none of these figures are absolute. And we're going to talk about some of those factors right now. Old farts like me. Age is a factor in the metabolism of drugs. After the age of 30, the liver begins producing fewer and fewer enzymes to metabolize select chemicals, such as alcohol and the sedative hypnotic drugs. So as you get older, you don't metabolize them as well. Race has been shown to be a factor in levels and types of enzymes maintained in the liver. Caucasians tend to maintain enzymes used to metabolize alcohol rapidly, while Asians metabolize alcohol slower and with more side effects, quicker drunkenness, and a rapid flushing of the face. As weird as that sounds. Hereditary factors can affect metabolism. Some people inherit fewer enzymes. Some people inherit more body fat to store drugs in. Some people inherit a high metabolic rate to help eliminate drugs. And this is why you see Several different types of alcoholics. You see the ones that are so skinny. How in the world can they drink so much? You might ask yourself, and the answer is that they have a high metabolic rate, so they process the alcohol very rapidly through their bodies. Other people that tend to be able to drink a lot of alcohol are people with a lot of fat on their bodies. These people can drink a lot of alcohol because they have a lot of fat to store the alcohol in. Health can affect metabolism, of course. Unhealthy people tend to metabolize chemicals slower or less completely. For example, the individual may have severe liver damage due to hepatitis or cirrhosis. Just about any disease, you catch a cold, you have the flu, don't drink alcohol because it's going to affect you even more because you're sick. An individual's emotional state changes the effects of a drug. Anger or anxiety in a person using methamphetamines may cause episodes of lashing out or violence. The presence of other drugs will delay the metabolism of select drugs. When alcohol is used with Xanax, and Xanax will stay in the body 2 or 3 times longer than normal. This delay of metabolism and exaggeration of effects is called drug synergism. Not everyone's body chemistry is the same. This is why some people are allergic to select drugs and others aren't. Some people lack the enzyme that metabolizes cocaine, so even a small amount in the system will result in an exaggerated reaction and even death. Other factors that can affect the metabolism of the psychoactive drug: your weight, the level of tolerance that you have, monthly hormonal cycle of a woman, enzyme induction, enzyme inhibition, weather. How strange is that? When it's overcast and the barometer goes crashing down, like the hurricane that's about to hit the southwest, you get drunk faster. It pushes it into your system faster, as weird as that sounds. So the weather can affect your reaction to drugs. In order to understand the effects of psychoactive substances that they have on the nervous system in general and the central nervous system in particular, we need to review the various nervous systems that control our bodies. The nervous system can be divided into 2 basic parts: the central nervous system, which consists of the brain and the spinal column and controls most nervous responses. The peripheral nervous system is the other one. It's the system which encompasses all the other nerves outside of the central nervous system and communicates impulses to the central nervous system. And here's your central nervous system, your spinal column, and your brain. And here's all the other nerves that feed the central nervous system. The peripheral nervous system collects information, sends it to the central nervous system, which then responds to the stimulus back through the peripheral nervous system. The proper response will be through the appropriate system of the body: the nervous system, the skeletal system, the endocrine system, the digestive system, the respiratory system, the muscular system, the circulatory system, the urinary system, the lymphatic system, and the integumentary system, which is your skin. Psychoactive drugs may alter information headed for the brain. Painkillers block the chemicals that tell the brain that they are in pain. Psychoactive drugs can disrupt messages sent to the back part of the body when someone is so drunk that their hands and feet don't work properly. Psychoactive drugs can disrupt thinking. Alcohol again. Psychoactive drugs may affect an organ when they pass through it, or affect them when the central nervous system sends back a distorted message. Evolutionary psychologists speculate that any changes to the human form, including the brain, continued because they assisted the individual in their survival. A good example of this is the human affinity for sugar and fat, which provides a quick and more prolonged energy source. Another example would be the affinity for sexual intercourse for both males and females, which led to offspring which guaranteed the survival of the species. Following the evolutionary premise, psychoactive substances must serve some purpose. One reason may be that most psychoactive substances affect our natural survival mechanisms, but initially cause desirable effects. Eventually, as humans, we may adapt to the effects of these substances, but as for now, these substances are subverting our survival mechanisms, and in many cases, the result is anti-survival. The human brain not only maintains the largest cerebrum, the new brain, of all creatures, but all the structures of the lower animals, the old brain. So we not only have all the new stuff, but we have all the old stuff too. As survival became more complex, higher animal forms developed new brain structures to aid them with survival. The primitive primal or old brain consists of brainstem, cerebellum, midbrain, the mesocortex, the limbic system. These brain structures can be found from animals as primitive as fish to human beings. And there's their old brain right there and right here. There's their old brain. The old brain regulates physiological functions. Respiration is regulated in the brainstem. Heartbeat is regulated in the brainstem as well. Your body temperature, brainstem again. The hormone release is controlled by the hypothalamus and the pituitary gland, and your movement is controlled by the cerebellum. The old brain, the limbic system, is the area that acknowledges the experience of basic emotions and cravings. Fear, anger, hunger, thirst, lust, pain, and pleasure all come out of the limbic system. The old brain is the area that imprints survival memories, specifically the limbic system. Most psychoactive substances act on the old brain, causing euphoria in this area, and thus providing the euphoric memories that lead to addiction. The emotions of the old brain overpower the reasoning capacity of the cerebrum and lead to the repeated taking of euphoric substances. As hominids advanced over time, more and more brain power was needed to survive. This came to us in the form of the cerebrum and the highly convoluted neocortex. The new brain aids us in solving the problems of survival. Most of the time, the new brain controls the old brain. Reasoning trumps emotion. However, when a person uses psychoactive substances, the craving from the old brain may override rational arguments. It's too expensive, it has bad side effects, it's dangerous. I have other responsibilities that are more important than my pleasure. And of course, depending on the psychoactive substance and the emotions that it induces, most of this is overridden. The reward reinforcement pathway encourages a human to perform or repeat an action that promotes survival. It is this pathway that is affected by psychoactive substances. Also referred to as a mesolimbic dopaminergic reward pathway, it has a stop switch, the orbitofrontal cortex, and a more switch. The more area is also known as the pleasure center and encompasses four structures: the amygdala, the lateral hypothalamus, the nucleus accumbens septi, and the ventral tegmental area. The pleasure center serves two purposes. It gives a feeling of satisfaction when a need is fulfilled, or even the anticipation that the need will be fulfilled. It gives a surge of relief or intense satisfaction when pain is diminished. Psychoactive substances activate the pleasure circuit and rewards the individual with a feeling of satisfaction or pain relief. Unfortunately, psychoactive substances overactivate the pleasure center and shut down the stop switch, enabling the individual to feel an intense need to continue use. 3 phases of brain activity with the reward and reinforcement pathway. 1. The anticipation of drug use or compulsive behavior creates craving. Internal or external cues activates the amygdala, which causes a release of dopamine from the ventral tegmental area, which in turn activates the nucleus accumbens, causing craving. For an alcoholic passing a bar, an external cue, it would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for alcohol. For someone who smoked pot with their friends before they went away to school, when they see their friends on spring break, an external cue, it would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for pot. The second phase of the reward reinforcement pathway involves the brain telling the individual to do it again after ingesting the psychoactive substance. With use, dopamine is released from the ventral tegmental area, which activates the nucleus accumbens to continue craving. Phase 3 of the reward reinforcement pathway involves the nucleus accumbens signaling the orbitofrontal cortex that it has taken the substance, and asks for a signal of more or satiation. In addicts, the abusers, this signal is weakened, as is the reasoning function of the area, resulting in ingestion that does not lead to satiation. Psychoactive substances imprint the memory of euphoria or pain relief more deeply than most natural survival memories. The alteration of brain chemistry causes normal activities to be less pleasurable. To a methamphetamine addict, the desire for the drug will be more important than her relationship with her children. As a matter of fact, methamphetamine addicts have been known to prostitute their children or even sell their children for a fix. To the compulsive gambler, gambling will become more important to them than food or sex. Psychoactive substances tend to affect the physiological functioning of the body, especially the heart rate and respiration. It is the effect on respiration that causes most drug overdose emergencies and death. Psychedelics, LSD, marijuana, and the rave drugs not only affect the old brain, but the new brain as well. These drugs especially affect memory as they activate 2 areas of the brain that help to control memories, the amygdala and the hippocampus. As people age from childhood to adolescence to adulthood, they learn to integrate the drives of the old brain with the reasoning and common sense of the new brain. Developmental problems, childhood traumas such as chaotic or abusive childhoods, compulsive behavior, or psychoactive drug use can circumvent survival mechanisms and lead to irrational behavior or addiction. And she's doing it right. You got to go with the flow of the blood. The most important structure of the reward reinforcement pathway is the nucleus accumbens septi. This bundle of nerves is the most powerful reinforcer in the pathway. It is this area of the brain that drives people to action. Research with rats stimulating this area of the brain led to death. They could do nothing else but stimulate this area. Human subjects who stimulated the same area behaved in a similar manner to the rats. Social factors tend to affect the obsession to use the psychoactive substance. The psychoactive substance alters the brain chemistry to make the individual want to use. This is one reason why only complete abstinence will stop the craving. To begin again will lead to the craving starting at the same intense level. Brain imaging has shown that brain cells change as addiction develops. While normal memory doesn't take place until an action has been repeated 3 or more times,
Intense stimulation can cause sensitization with just one encounter. These neural pathways are highly sensitive and may cause relapse in just one additional encounter. Why do psychoactive substances disrupt the on-off switches of the reward reinforcement pathway? One theory is that since they don't originate from an essential body need, the brain has no satiation point established for psychoactive substances. And she is passed out drunk. The second theory is that the on-off switch gets stuck in the on position. The person doesn't realize that the act has been completed. The person will use until they run out of drug or pass out. And this guy has passed out after drinking Budweiser, I think. And he's broken that chair. The third theory is that the psychoactive drug creates such euphoria or pain relief that the on-off switch is ignored or overridden by the brain. The fourth theory is that the psychoactive substance disrupts communication between the old and the new brains. Many psychoactive substances incapacitate the thinking and reasoning portion of the new brain, and the individual reverts to the old brain instincts or automatic functioning. The main instrument of the nervous system is the neuron. The neuron is composed of the soma, the axon, and dendrites. Information comes into the neuron through the dendrites and is distributed to the other entities through the terminals at the end of the axon. Each neuron can make contact with one entity up to 150,000. It is estimated that there is between 100 trillion to 500 trillion neuronal connections in the human body. Neurons are different lengths from fractions of millimeters to the sciatic nerve that can be a meter long and runs from the heel to the spinal column. Neurons do not touch, but they do communicate with one another. This communication takes place in the synaptic cleft, a gap between the two neurons. In order for the two neurons to communicate, a chemical messenger called a neurotransmitter must pass between them. The neurotransmitter is housed in tiny sacs called vesicles, and these are the vesicles right here. And this is the neurotransmitter. And these are the receptors. Acetylcholine is a neurotransmitter that activates muscles. It works as a vasodilator. It controls mental acuity, memory, and learning. A decrease with age causes rapid dementia, referred to as Alzheimer's disease. It was the first neurotransmitter discovered, and it's a monoamine. Norepinephrine and epinephrine are also monoamines. They were the second neurotransmitters discovered. They act as stimulants when the body demands energy. They control hunger, attention span, motivation, confidence, and alertness. Epinephrine creates energy, norepinephrine, confidence, and feelings of well-being. Dopamine regulates fine motor muscular activity, emotional stability, satiation, reward reinforcement pathway. Dopamine is the most important neurotransmitter involved in drug abuse. Reduced dopamine leads to Parkinson's disease. Excess dopamine causes schizophrenia. And the picture on your left is was done by an artist who suffered from schizophrenia. And in this picture, he's fine. In this picture, he's starting to relapse. In this picture, he's relapsing worse. And here he has a full-blown psychotic episode. Another monoamine neurotransmitter is histamine. It controls the inflammation of tissue and allergic reactions. It regulates emotional behavior and sleep. One of the reasons why you take an antihistamine when you have an allergy is to control the inflammation of whatever tissues you're dealing with, usually your lungs. Serotonin is also a monoamine. It controls mood stability, such as can cause depression, appetite, poor appetite, or too much appetite, sleep, and sexual activity. Mood can be elevated by forcing more serotonin into the synaptic cleft, and this is one of the reasons why we have antidepressants such as monoamine oxidase inhibitors and selective serotonin reuptake inhibitors and tricyclic drugs, because they increase the amount of serotonin in the synaptic cleft, making the individual less depressed. Enkephalins, endorphins, and dynorphins are opioid peptides. They are involved in regulation of pain, relief of stress, immune response, stomach activity, other physiological functions. One of the amino acids is gamma aminobutyric acid, or GABA. It's the main inhibitory neurotransmitter. It's involved in 25 to 40% of all the synapses in the brain. It controls impulses, muscle relaxation, arousal. It slows down the brain. Alcohol has a strong effect on GABA. Another amino acid is glycine. It's an inhibitory neurotransmitter, just like GABA. It's found in the brainstem and the spinal cord. It slows down the brain. It's prominent in protein synthesis. Another amino acid is glutamic acid, or also known as glutamate and glutamine. It's an important excitatory neurotransmitter. It plays a major role in cognition, motor function, sensory function, and reinforces memory. It's a precursor for GABA. Tachykinin is a form of tachykinin is substance P. The P stands for peptide. It conveys the pain message to the brain from the peripheral nervous system. Enkephalins will block substance P so that the pain message doesn't get to the brain. Anandamide has an affinity for the receptor sites. It's a lipid neurotransmitter. Anandamide has an affinity for the receptor sites that accommodate THC. Found in the limbic system, integration of sensory experiences with emotion. It controls learning, motor coordination, and memory. It acts as an analgesic. Pituitary peptides. Corticotropin leads to ACTH and cortisone. It aids the immune system. It helps healing. It is part of the stress control. One of the gases, this is a new one that we haven't known about for very long, only since 1992. It was discovered in 1992. It's nitrous oxide. The functions of nitric oxide just continues to expand. It is necessary for erectile function of the penis. It helps regulate emotions, and in too large doses, it can cause cancer and vascular collapse. Alcohol directly affects GABA, metenkephalin, and serotonin. Benzodiazepines directly affect GABA and glycine. Marijuana affects anandamide, 2-AG, acetylcholine, and dynorphin. Heroin affects endorphins, enkephalins, and dopamine. LSD affects acetylcholine, dopamine, and serotonin. Nicotine affects epinephrine, endorphin, and acetylcholine. Cocaine and amphetamines affect dopamine, epinephrine, norepinephrine, serotonin, and acetylcholine. MDA, and MDMA affect serotonin, dopamine, epinephrine, and norepinephrine. PCP affects dopamine, acetylcholine, and alpha endopsycin. Neurotransmitters attach themselves to receptor cells on the receiving entity, the muscles, the organs, and other neurons that are chemically structured to only accept that neurotransmitter. However, select receptor sites may have different functions for the same neurotransmitter. There are 7 types of serotonin receptors. Each has a slightly different function. Dopamine has 5 types of receptors referred to as D1 through D5. So it would be D1, D2, D3, D4, and D5. The D2 receptor is the site that is used by most psychoactive substances. Each neuron maintains and transmits only one type of neurotransmitter, except for neurons that transmit epinephrine, which may also transmit norepinephrine. However, a neuron may have receptor sites for any number of neurotransmitters. A neuron is stimulated when it receives enough neurotransmitter to create a chemical imbalance in the neuron that forces sodium and potassium gates to open. The increase in positively charged sodium and potassium ions from outside the neuron and flooding out of the negatively charged chloride ions causes an electrical chain reaction to run down the neuron to the axon terminal. At the axon terminal, the electrical stimulation causes the vesicles to release their neurotransmitter into the synaptic cleft, which in turn stimulates a partner neuron. Excitatory neurotransmitters work by opening sodium gates, allowing sodium into the neuron. Inhibitory neurotransmitters work by opening chloride gates, making the neuron more negative and thus more difficult to stimulate. The stimulation of the neuron by the neurotransmitter is known as the first messenger system. If the neuron is stimulated by another entity, such as a biological or chemical change, it is known as a secondary messenger system. The neurotransmitter can't remain in the synaptic cleft or the reaction won't stop, so it must be removed. This occurs in one of 2 ways. The neurotransmitter is chemically broken down. Acetylcholine is broken down into acetylcholinesterase, is broken down by acetylcholinesterase. The neurotransmitter is taken back by the neuron that originally distributed it in a process known as reuptake, and that's what happens to serotonin. Hence, the medication that causes more serotonin in the synaptic cleft would be a selective serotonin reuptake inhibitor. So it inhibits the reuptake of serotonin, and that's why it works. The number of receptor sites is not constant. When the amount of neurotransmitter decreases, the cell will increase the number of receptors so that as much neurotransmitter as possible finds a place to attach. And this is known as upregulation. So let's assume that you've been using cocaine. You've been using cocaine and now your body craves it. Why does it crave it? Because you're not getting it, and there is an upregulation of your nerve cells, your nerve receptors. If there is too much neurotransmitter in the synaptic cleft, the number of receptor sites will decrease to prevent overstimulation. And this is known as downregulation. This occurs when someone takes drugs. The individual takes more and more of the drug, trying to achieve the same reaction as they had originally. Excessive use of drug may cause a permanent downregulation. And of course, this is what we're talking about when we're talking about addiction, because they have to take more and more of the drug in order to try to find the same reaction. Psychoactive drugs work because they act as either agonists or antagonists. Agonists either mimic or facilitate the effects of a neurotransmitter. Nicotine is an agonist for acetylcholine. Ethanol is a agonist for GABA, LSD for serotonin, and THC for anandamide. This happens partially. It is known as a partial. This happens partially, it is known as a partial agonist. Antagonists block neurotransmitters. If the receptor is stabilized, making it inactive by a drug, the drug is referred to as an inverse agonist. How drugs affect neurotransmitters? They can block the release of neurotransmitters. Heroin blocks the release of substance P, taking your pain away. They can force the release of neurotransmitters, forcing more to be released than is released naturally. Cocaine forces the release of norepinephrine and dopamine. Ecstasy, MDMA, forces the release of serotonin. The drugs can prevent the reabsorption of the neurotransmitter. SSRIs block the reuptake of serotonin, elevating the person's mood. The drugs can inhibit an enzyme that helps synthesize a neurotransmitter. Blood pressure medicines inhibit enzymes that allow the production or norepinephrine, which would cause high blood pressure if it was allowed to be released in the synaptic cleft. How drugs can inhibit enzymes that break down neurotransmitters in the synaptic cleft, allowing neurotransmitters to remain in the cleft. Methamphetamine inhibits monoamine oxidase and catechol-O-methyltransferase, which breaks down norepinephrine and epinephrine in the synaptic cleft. The drug can interfere with the storage of the neurotransmitter. The drug can be a combination of any of these interactions. While some drugs have desired effects like making the individual resist fatigue or block pain, they can also be dangerous. Cocaine forces the release of norepinephrine and dopamine, which makes the individual not only stay up beyond normal exhaustion, but responds in an overly excited and sometimes violent manner. Heroin blocks pain and creates a euphoric sensation by attaching to receptor sites in the reward reinforcement pathway, but unfortunately also attaches to the breathing center, depressing respiration. Let's not do this. Oh no. Sorry. I already did this once tonight. Sorry about this. This will be done in just a second. I don't know why it's doing this to me. There we go. While some drugs have desired effects like making the individual resist fatigue or block pain, they can also be dangerous. Cocaine forces the release. We've already done that. No, we haven't. Cocaine forces the release of norepinephrine and dopamine, which makes the individual not only stay up. Oh, no, we have done that. Why is this happening? What is happening? LSD acts as both a stimulatory neurotransmitter and alters the user's perception of external messages, mixing their perceptions so that they may hear images and see sounds. And this is known as synesthesia. Other psychedelics block the action of acetylcholine, creating hallucinations. The body may deal with drugs in several ways. It may develop a tolerance to it. It may develop a tissue dependence to it. It may have psychological dependence that occurs. You may go through withdrawals. It may break down the drug or metabolize the drug. Any foreign substance will be treated as a toxin by the body. The liver and kidneys will try to eliminate it so that it cannot do any damage. If the individual continues to use the substance, the body will adapt to having the drug present. This adaptation to the presence of a toxin is called tolerance. Tolerance to the drugs will force the individual to take more and more of the drug to get the same effect. A methamphetamine user will achieve a certain level of euphoria and energy for the first time they use it. If they use every day for 100 days, by the 100th day, they will have built up a tolerance for the drug that will necessitate a 20 times increase on the amount that they used the first time. And that's what you look like. In order for tolerance to occur, sometimes the drugs must be taken irresponsibly. If the individual is taking Valium at higher doses, then the doctor prescribes, or the doctor is prescribing heavy usage of the medication, the tolerance will be accelerated. Research shows that there are individuals who have built up a tolerance to the degree that they were using 100 to 200 times the standard dosage. Tolerance will return to normal if the drug is no longer used. Types of tolerance, dispositional tolerance, the body accelerates the metabolism of the drug by producing more of the enzyme used to metabolize a toxic substance. The more people drink alcohol, the greater their tolerance because of dispositional tolerance. Thus, the individual will have to consume high levels of alcohol to become intoxicated. Pharmacodynamic tolerance is affected by nerve cells which will become less sensitive to the drug. When opioids are used, neurons begin generating fewer receptor cells to the opioid to lessen its effects. The body will also produce cholecystokinin as an antagonist to the drug. Cholecystokinin is a substance that comes out of your gallbladder. Behavioral tolerance, the brain compensates for the effects of the drug by using parts of the brain not affected. A person who is drunk can force themselves to appear sober when necessary. Reverse tolerance, as the drug destroys tissue, the user becomes more sensitive to the drug and can tolerate less and less of the substance. This happens to alcoholics who suffer from cirrhosis of the liver. Since the liver doesn't work as well, a little alcohol will get them drunk because the liver is not operational enough to metabolize the alcohol. Acute tolerance or tachyphylaxis. The brain and the body adapt instantly to the toxic effects of the drug. Tolerance to tobacco occurs this way. People who try to commit suicide using barbiturates may experience the same instant tolerance and survive twice the lethal dosage. LSD will not work if 2 doses are taken close together due to tachyphylaxis. Select tolerance, the body develops tolerance to mental and physical effects at different rates. This occurs with opiates and sedatives. With barbiturates, sleep will be induced long after the euphoric effect is no longer present. Inverse tolerance or kindling, the brain chemistry changes so that the person becomes more sensitive to the effects of the drug. With continued use, cocaine and marijuana users will get a minimal effect, and then after months will start to get an intense reaction. In the case of cocaine, it might cause heart attack or stroke. Cross tolerance, if a person develops a tolerance for one drug in a family of drugs, they will be tolerant to other drugs in that family. The opioid family is this way. Tolerance to heroin will make the person equally tolerant to morphine, codeine, or methadone. A person tolerant of Xanax will be tolerant to other benzodiazepines and even the depressant alcohol. A person tolerant to barbiturates will be tolerant to benzodiazepines. Tissue dependence. This is the biological change of the body to adapt to the presence of the drug. This usually occurs after prolonged use. Allostasis sometimes will occur when the tissue and the organs of the body depend on the drug to be functional. In these circumstances, cessation of the drug usage will cause dangerous and dramatic withdrawals. In select circumstances, cross-dependence will occur where the dependence of one drug can be alleviated with another drug. Psychological dependence, addiction used to mean that the person taking the drug was tissue dependent on the drug. But with continued research in brain imaging technology, it has been recognized that psychological dependence is an important factor in addictive behavior. The altered states of consciousness that are caused by select drugs can lead to continued misuse to avoid life's problems. Psychological dependence, it is not acknowledged that psychological dependence. It is not acknowledged that psychological dependence occurs before tissue dependence, and that the response rate from either is similar. Psychological factors that induce reinforcement: drug automatism, the individual uses the drug aimlessly, unconsciously, and repetitively. Negative reinforcement, unpleasant states encourage drug usage. Smokers will wake up in the middle of the night to smoke and dissipate nicotine to dissipate their nicotine withdrawal. Social reinforcement, peer pressure, and the need for social inclusion encourages continued use. The physiological responses to drugs: opioid effects causes numbness, euphoria, dryness of mouth, constipation, decreased pulse, low blood pressure, shallow breathing, and inability to cough, and pinpoint pupils and malaise. And in the emergency room, if somebody came in and we thought they had overdosed, we would look at their eyeballs in order to see their pupils to see if they were dilated. These guys have pinpoint pupils. They have no opening in their eyes at all. Well, it's very tiny. Withdrawal symptoms for opioid substance, it's the very opposite of what we were just talking about. Everything is opposite. Tactile reaction, there's pain, psychological reaction, anxiety, depression, or craving. Physical excretory reaction, sweating, and it stinks. It smells so bad. Runny nose, tearing, increased salivation. Digestive tract reaction, they have diarrhea. Before, if you remember, they had constipation. Circulatory reaction, hypertension. Respiratory reaction, excessive coughing. Optic reaction, dilated pupils. Muscular reaction, severe hyperreflexes and muscle cramps. Withdrawals, drug withdrawal is the body's attempt to rebalance itself after cessation of prolonged use of psychoactive substances. Many times for a chronic user, fear of withdrawal is one of the reasons for continued use. Withdrawal often entails muscle aches, pain, insomnia, vomiting, cramps, and on occasion convulsions, which are the danger. This is what kills people, convulsions. Non-purposive withdrawal, visible physical signs due to tissue dependence. The individual has seizures, sweating, goosebumps, crawling flesh, vomiting, diarrhea, and tremors. So trying to get the toxins out of their system. Purposive withdrawal, expectation of withdrawal symptoms causing the rationalization of continued use of the psychoactive substance. Withdrawal effects can be observed whether there is tissue dependence or not. Protracted withdrawal, heavy craving for the drug even after the addict has been detoxified. This is usually cause for an external cue that causes the subject to have flashbacks to use and withdrawal symptoms. This often causes a recovering addict to relapse, the protracted withdrawals. Post-acute withdrawal symptoms, persistent emotional and physical problems that last from 3 to 6 months after recovery. It's unclear thinking and cognitive impairment, memory problems, emotional overreaction, sleep disturbances, motor coordination, dizziness problems, difficulty managing stress, and craving the drug. And if you know anything about this, a lot of times, what was I thinking? 3 to 6 months. What was I thinking? Oh, I was thinking, yeah, meth head, when people have meth head, it can take up to 18 months for them to go back to normal. That's what I was thinking. Sometimes drug abuse is a symptom of other underlying problems. When this is the case, the user will sometimes seek the desired effect by experimenting with drug usage. Replacement, they will replace the desired drug with another intoxicant. Multiple drug use of different drugs to alleviate differing symptoms. Cycling, using a drug intensely for a period of time and then abstaining to lower tolerance or allow the body to repair. Stacking is using two or more similar drugs at the same time to achieve a specific effect. Mixing, using drug combinations to acquire a new effect. Speedballs are cocaine mixed with heroin. Marijuana laced with cocaine, ecstasy, and LSD, X and L. Methadone and Klonopin mimics heroin. Sequentialing, going from one addiction to the other. This can either refer to drug sequentialing, drug replaced by a compulsive behavior, or one compulsive behavior replacing another. Morphing is using one drug to counteract another. A cocaine user drinking alcohol to come down, using coffee to come down off of a drunk, using methamphetamine to function during a heroin high. Levels of use is determined by the amount used, the frequency of use, the length of time psychoactive substances have been used, the impact of the drug usage has on the user's life. The categories of usage include abstinence, that's where I am, experimentation, social recreational use, habituation, abuse, and addiction. Many individuals cannot choose their level of drug use, but are at the mercy of the psychoactive properties of the drug being used. Abstinence means that the individual does not use any psychoactive substances except accidentally. Even if the person has a strong hereditary or environmental susceptibility for compulsive drug use, then by never starting, they never get hooked. These individuals might display other compulsive behaviors such as gambling, overeating, compulsive internet use, excessive sexual behavior. I have a friend up north who was an alcoholic for 17 years, and he went cold turkey. He went cold turkey, but now his problem is that if he gets his hand on any money, whether it's his or not, he'll gamble it away. And it's not like he's trying to win anything because he wants to lose. He wants to get rid of all of his money. He doesn't feel like he deserves it. It's just so strange. Research shows that individuals who wait until they are 18 years or older to experiment with alcohol, nicotine, or marijuana are less likely to use these substances as gateway drugs for more dangerous substances such as cocaine or heroin. However, if the individual experiments between the ages of 10 and 12, they're more likely to use the early experimentation as a gateway to more serious usage. Individuals who don't start smoking until age 21 are very unlikely to develop an addiction to nicotine. Anyone who doesn't try an addictive substance until the age of 21 will probably not become addicted. Experimentation with the psychoactive substances occurs because of curiosity, but no pattern of usage is developed and there are no negative consequences from the experimentation unless usage leads to injury, accident, or illness. The individual has an exaggerated reaction, a pre-existing physical or mental condition is exacerbated, the user is pregnant, the individual is arrested for use, heredity or environment dictates addiction, previous addiction with other substances leads to relapse. So, social recreational use, users may seek out a drug for the effect, but no permanent patterns of use is developed. Usage can be controlled for these individuals as long as they do not develop drug-seeking behavior. Habituation, the individual has developed a pattern of usage, but there has been no negative effects on the individual's life. This is referred to as habituation because though there is no increase of usage, the usage pattern indicates that there is a definite craving for the substance, and this is known as habituation. Abuse, the individual continues to use the substance despite the negative life consequences that have occurred. These consequences can be personal, such as broken relationships, problems in their social lives, Financial problems, legal problems, continued use despite arrest for possession, medical problems, their personal health, if an alcoholic has diabetes, a heavy smoker has emphysema, the cocaine user has hypertension. Work or school related, as we all know, emotional stability, LSD users with mental instability. Addiction, the difference between abuse and addiction is the compulsive behavior of the addict. Addiction is a classification if the individual has no control over duration of usage or the amount used. The individual has been unsuccessful at control. They spend an inordinate amount of time obtaining drugs or recovering from usage. They limit social, occupational, or recreational activities for use. They continue use despite physical, social relationship or psychological problems. They use in the morning for a jump start on the day. They defend their drug usage with anger or even rage. They experience withdrawal when unable to use the drug. They must increase the amount used to obtain the desired effect. Addiction comprises the 4 C's. Control, loss thereof, compulsive use of the drug, craving the drugs, and continued use of the drugs. The American Psychiatric Association has identified substance use as a mental illness since the printing of their first diagnostic and statistical manual of mental disorders in 1952. The current DSM-5 divides substance abuse disorders into two general categories: substance-related disorders and substance addictive disorders. The DSM-5 deals with several drugs, which include alcohol, stimulants, cannabis or marijuana, cocaine, hallucinogens, inhalants, opioids, anxiolytics, which are anti-anxiety drugs, sedatives, hypnotics, caffeine, and tobacco. The addictive disease model, this model of addiction sees addiction from the medical point of view, that addiction is a disease, it's chronic, it's progressive, you can relapse from it, it's incurable, and it's potentially fatal. This model assumes that the addiction is caused from genetic irregularities in brain chemistry and anatomy that are triggered by certain drugs. Research shows that heredity influences drug use and addiction as much as 40 to 60%. The addictive disease model, compulsive drug use with prolonged intoxication with a need to continue use, inability to control use, inability to stop use despite physical, mental, or social problems, repeated attempts to control use, increased intake over time. It's incurable. Pathological reactions such as blackouts or dramatic personality changes. Behavior environmental model, this theory purports that negative environmental factors such as abuse, anger, and peer pressure may cause people to seek, use, and sustain a dependence on substances. This model emphasizes the progressive nature of the 6 levels of drug use: abstinence, experimentation, social recreational use, habituation, abuse, and addiction. The academic model, the addiction occurs when the body adapts to the toxic effects of the drugs at the biochemical and cellular levels. Natural balance has been thrown off, causing 4 physiological changes: tolerance, tissue dependence, withdrawal syndrome, psychological dependence. The diathesis stress model, this model was first developed to explain the causes of schizophrenia. It is a combination of the addictive disease model and the behavioral environmental model. Diathesis means a predisposition or vulnerability to, and in this case, the individual may have a genetic and environmental predisposition to drug addiction. It stress stress triggers. Oh, gee, Merry Christmas. Stress triggers the drug need, and the stronger the diathesis, the more likely that the individual will drift into addiction. Heredity, researchers have found that genetics does influence addiction, but that there are over 100 genes that have something to do with drug abuse. Receptors, gene transcription factors, enzymes, neuropeptides, G proteins, and transporters all have a lot to do with whether you become addicted or not. Looking at twin studies, Goodwin found that if of identical twins separated at birth were most likely to choose the addiction or abstinence patterns of their biological parents over their adoptive parents. Similar research found that 61% of the sample maintained nicotine dependence similar to their biological parents, and 55% displayed the same alcohol dependence of their parents. Researchers looking at males in treatment found that children with one alcoholic parent had a 34% greater probability of being an alcoholic than the male children of non-alcoholics. When both parents were alcoholics, the child had a 400% probability of being an alcoholic. If both parents and a grandfather were alcoholics, the individual had a 900% greater probability of being an alcoholic. 28 million Americans have one parent who is an alcoholic. Researchers have found that 70% of severe alcoholics have a dopamine controlling gene called DRD2A1. Among social drinkers, only 30% have the gene. When this gene is present, the individual has fewer dopamine receptor sites in the nucleus accumbens. Since many of the missing sites are D2 sites, the individual will need more intense stimulation to feel satisfaction. The DRD2A1 gene seems to indicate the tendency for any problem behavior, as it has been found in other addictive behaviors other than alcoholism. Gambling, ADHD, aberrant sexual behaviors, overeating, antisocial personality disorder, and Tourette's syndrome. Some refer to this gene as the compulsivity gene, and the process as the reward deficiency syndrome. People with DRD2A1 tend to consume large quantities of psychoactive substances before becoming intoxicated, and then have a greater dysfunction when they do get drunk, such as blackouts and brownouts. There are also genes that make it less likely that a person will develop an addiction. DRD4 gives the individual an excess of dopamine, which has been shown to play a role in spiritual acceptance, making it less likely that the individual will accept the addictive lifestyle. Environment, interactions with the environment, but especially the home environment, make new nerve cell connections and alter the neurochemistry that the individual was born with, determining how the individual will use psychoactive drugs. Factors in the environment: physical, sexual, emotional abuse, stress, love, poverty, living conditions, family relationships, nutritional balance, healthcare, neighborhood safety, school quality, peer pressure, the internet, and television. The environment molds the brain's architecture and neurochemistry, determining how the individual will react to outside influences. This is especially true in the first 10 years of life. The brain develops from the front to the back, meaning that adolescents are more prone to poor impulse control behaviors like substance abuse. Recent research shows that it takes at least 20 years for the brain to become hardwired, and the prefrontal lobe continues to grow until around the 44th year. Memories are established through a network of neurons involving select neurotransmitters: norepinephrine, serotonin, acetylcholine, dopamine. The more an action is repeated, the more likely the individual will remember it, unless the memory is emotionally intense, in which case the memory has a stronger memory network, hence the intrusive memories of a traumatic event that may end up causing post-traumatic stress disorder. Children growing up in an in a chaotic environment where there is excessive emotional pain can deal with the pain in several ways. They can face the pain and try to deal with it. They can find people to help them deal with it. They can accept what happened. They can run away. They can become hyperactive. They can become angry and fight. They can make jokes. They can develop an addictive use, such as with drugs, food, gambling, or sex. If the stress continues over time, the counterbalancing behavior will become ingrained in the brain and becomes part of the individual's personality. In the future, when an unwanted emotion arises, they will be drawn to the simplest solution, their counterbalancing behavior, whether that's running away, being hyperactive, dealing with it, accepting it, making jokes. They will use the same technique in order to survive. The people most likely to abuse drugs, stress is common in the home. Abuse of some kind occurs in the home. Drugs or drinking are commonly used in the home or among the individual's peers. Healthy ways of reacting to stress and or anger aren't learned. Society tells the individual that psychoactive substances are normal and an acceptable way to solve life's problems. Living in a community where access to legal and illegal drugs is easy, there are pre-existing mental conditions exacerbated by the negative home environment. Healthy brain chemistry can't be maintained because of poor nutrition. The media inundates the individual with advertisements supporting the use of select psychoactive substances. One belongs to a peer group where excessive use of psychoactive substances is normal. Psychoactive drugs, heredity, and the environment may prime an individual for addictive behavior, but it is the psychoactive substance that they decide to use that will determine the impact the addiction will have on their lives. Excessive drug use will not only make the individual more susceptible to more and more use, but more vulnerable to other stronger drugs. Psychoactive drugs select psychoactive substances, particularly methamphetamine, cause the death of brain cells through a process known as apoptosis, where damaged cells are programmed to kill themselves. Nicotine produces an immediate and long-term change to the levels of dopamine and norepinephrine, which leads to the faster development of tolerance and dependence. Some drugs have a greater power to positively reinforce and therefore compel to a continued use, such as cocaine and heroin. Compulsive obsessive behaviors mimics drug use, which in turn causes the brain to be rewired. This is what happens with gambling, with eating disorders, with shopping, with select situations, sexual activity, video games, and internet use. Research with video game usage has shown that dopamine is released to the reward reinforcement pathway when an individual plays video games, an amount equivalent to methamphetamine usage. PET scans of compulsive eaters have demonstrated that there is a decreased number of dopamine D2 receptor sites in the nucleus accumbens. Research shows that between 25 and 63% of compulsive gamblers have been dependent on alcohol or other drugs in their lives. It has been demonstrated that gambling creates brain disruption similar to drug or alcohol usage. The drug that pushes the individual the hardest and quickest into addiction is smoking, nicotine, and tobacco. Number 1, tobacco. The drug that pushes the individual the second hardest and quickest into addiction is smoking crack cocaine. The drug that pushes the individual the third hardest and quickest into addiction is smoking or injecting heroin. The drug that pushes the individual the fourth hardest and quickest into addiction is injecting methamphetamine. The drug that pushes the individual the fifth hardest and quickest into addiction is snorting cocaine. The drug that pushes the individual the sixth hardest and quickest into addiction is ingesting opioid painkillers. The drug that pushes the individual the seventh hardest and quickest into addiction is ingesting any amphetamine. The drug that pushes the individual the eighth hardest and quickest into addiction is ingesting sedative hypnotics. The drug that pushes the individual the ninth hardest and quickest into addiction is drinking alcohol. The drug that pushes the individual the 10th hardest and quickest into addiction is smoking marijuana. The drug that pushes the individual the 11th hardest and quickest into addiction is ingesting PCP. The drug that pushes the individual the 12th hardest and quickest into addiction is ingesting caffeine. The drug that pushes the individual the 13th hardest and quickest into addiction is ingesting MDMA, also known as ecstasy. The drug that pushes the individual the 14th hardest and quickest into addiction is ingesting LSD. The drug that pushes the individual the 15th hardest and quickest into addiction is ingesting peyote. That is the end, finally, of the chapter. So I'll talk to you guys next week. I won't talk to you next week, I don't